Hello, my name is Shane Dunn. This is my respiratory presentation for my Bio 520 class. Real quick, Professor, I'm going to talk to my students real quick. You don't have to count this as turn of time if you don't want to. Students, if I'm teaching for anatomy, this presentation will help you with respiratory. If you're my chemistry students, I will be helping and posting my OChem exam review later after this video. Okay, let's begin. So the first thing we'll talk about with respiratory, which is breathing, is Boyles Law. This concept will help us throughout the entire concept of respiratory. And basically, it is a chemistry law. And as a chemistry teacher, I tend to like chemistry a lot. Let's actually use the thing in the presentation. Okay. So Boyles Law is a gas law, and it usually is done with gases. And it has to do with the concept of pressure and volume. P1 is the pressure initially, or pressure 1. Pressure 2 is the pressure after doing some with volume. Volume 1 is the initial volume, and volume 2 is the volume after doing something with pressure. If you like mathematically saying, you can do this. If I'm trying to find pressure 1, right? Here we go, P2, V2, V1, right? Or I want to solve for V1, right? It's P2, V2, V1. This mathematically, if you can see this, is as the pressure increases, right? If I want pressure to increase, volume has to decrease. Whereas if volume increases, pressure has to decrease. If you like math, there's it mathematically. It's an inverse relationship. If you're like me, I don't like math equations like this when I first learned this concept. I liked pictures, and we can see that in these two jars. So I usually use pistons for an example. So I'm gonna say these are pistons instead. So I have a piston right here. And as the gas in the piston increases, it applies a force that pushes the piston upwards because gas wants to fill the container as much as possible. So an increase in volume of a gas applies its pressure everywhere, which generates a force upwards moving the piston, which decreases the pressure on the gas. However, if I were to apply more force, more pressure on this piston, see, I have two now, that will cause the gas to decompress, increasing the force of the gas, but also decreasing the volume. So if I increase pressure, I decrease volume. If I increase volume, I decrease pressure. And that's a relationship. You'll see that later on. So let's talk about external respiration. This is breathing, really. There's two parts of it. Most books and most anatomy classes will focus on the exchange between the alveoli sac and the capillaries, but I also want to talk about it with the bulk flow of oxygen in and outside the lungs. So we have this guy right here. Let's call him Bob. I don't know. It looks like Bob to me. And he wants to breathe in. So when you breathe in, right, what happens is your chest expands, right? Your intercostal muscles in your ribs move away, right? They create this empty space, which increases volume. And also your lungs expand, which increases volume. Well, if you increase volume, we just learned in Boyles Law, you decrease pressure. So the pressure inside my lungs decreases. Well, why is this important? Well, the external atmospheric air is always at a constant pressure where you live, unless you go up and down altitude, below sea level, but it's at a constant. If you decrease pressure by breathing in, the pressure inside your lungs is less than the external air. What happens? A vacuum is created and air is forced into your lungs, which is good. You want air in your lungs, right? Well, let's say you want to breathe out. Well, right, you exhale. That causes your intercostal muscles to compress, causes your lungs to get smaller. That decreases volume. Well, if you decrease volume, you increase the pressure in your lungs. Increasing the pressure of your lungs, right? Well, that's going to make your pressure inside your lungs more than the pressure outside, which causes you to exhale air outwards. That's how breathing in and breathing out technically works, Boyles Law. Now, that aside, let's talk about how most classes are going to help you be quizzed on this, and that's going to be within the alveoli sacs. So external respiration and just gas flow works on three parts. Surface area is a big part because increasing surface area, right? If you increase your surface area, you have more room to work with, which means more area for gas exchange. So you want high surface area. The alveoli sacs, right? If you take them all, measure your entire lungs and measure them, its surface area, it's way larger than the lungs itself. I think it's what, a football field, or is that the intestines? But it's funny. I forget which one it is. It's very, very big compared to the lungs itself, right? So a very increased surface area. And since we have this, capillaries can wrap around it, allowing for a lot more gas exchange to occur. The biggest part about this respiration is this partial pressure. So the partial pressure inside the alveoli for oxygen is 100. In the deoxygenated blood coming from the heart, it's 40. So the pressure difference forces oxygen to go into deoxygenated blood, which is good. We want oxygen in our blood because our hemoglobin then takes it on, and good. Inside the lungs, right, the pressure of CO2 for alveoli sacs is 40, while in deoxygenated blood, it's 45, which forces CO2 into the alveoli sacs. But at the same time, we're unloading oxygen from the lungs into the blood. We're picking up CO2 because of this pressure difference. And that's what partial pressure is, and that's the biggest thing about this. What is this whole thing with perfusion and ventilation? Well, this right here is the ability of the capillaries in lungs to keep this pressure difference equal. Let's say, for example, I'm an asthmatic, right? I have an asthma attack, which causes my bronchial tubes to collapse, right? Which will decrease volume, which will cause the pressure inside my alveoli sacs to increase, right? That's not good too much, right? So that will cause the pressure to increase, right? Okay, causes both of these pressures to increase. Well, that's good, isn't it? You want the pressure to increase so much. Yes and no. If the pressure increases too much, right, a lot more oxygen floods the blood than hemoglobin can carry, which causes gas bubbles to flow into the blood, which is not good. We don't want air bubbles or gas bubbles inside our blood. So our body's going to react and it's going to vasodilate or constrict to keep this pressure difference together. To do this, it's going to constrict and keep the pressure the same. Okay. Internal respiration is the exchange of gas between tissues and blood. So we're going to kind of ignore this part and talk about it with tissues. Have the same factors, surface area. So what happens is the tissues, cells that blood capillaries deliver oxygen to, have way more surface area than itself. Think about the stomach, right? All that surface area, the large intestine, small intestine, all the blood flow there, right, has way more. Here's partial pressure again. So inside the capillaries, just the lungs, it has 100 for oxygen, but inside the tissue, it's about 40. This causes the oxygen to leave the blood, or hemoglobin, and capillaries, and go into the tissues. Well, CO2 is higher in the tissues than in the capillaries. We gotta force it out. All right, there we go. That occurs. Ventilation, perfusion, same thing. We can vasoconstrict or vasodilate to keep the pressure difference the same. The second part of internal respiration is cellular respiration, and this is going to be glycolysis, the Krebs cycle, and oxidative phosphorylation. Cells breathe, and the product they make by breathing is they need O2 to be the final electron acceptor in oxidative phosphorylation. And the byproduct they make a lot of the times is they make CO2. So that's why tissue cells have tons of CO2 and not a lot of oxygen, because they take that oxygen and they make CO2 with it. This is very important inside of the Krebs cycle and oxidative phosphorylation. We make most of this in the Krebs cycle. Let's talk about oxygen hemoglobin distribution curve. So I kind of talked this curve already before, but let's talk about it again. This curve allows us to think about how oxygen binds to hemoglobin. So, because it's oxygen hemoglobin distribution curve. So when oxygen binds to hemoglobin, it's going to, at a certain pressure, it's going to force oxygen into the hemoglobin. And once the first one gets in, it causes a conformational change, which makes it really easy. But once one hemoglobin has 4 oxygen, it kind of teeters out because there's no more room for oxygen to come into. So around 40 or 60 partial pressure of oxygen, it kind of stops because all the hemoglobin is full of oxygen. And it kind of works the opposite way. When you want to dump oxygen, right, you kind of go backwards. You gotta dump it out the same way. Well, there's ways to affect this oxidation distribution curve. So there's a rightward shift and a leftward shift. Let's talk about the rightward shift, which is called the Bohr effect. So increasing it towards the right will make the graph, the curve look like this, right? Kind of goes this way. This down here increases the partial pressure of oxygen needed to saturate hemoglobin. So it causes hemoglobin to need to have higher pressure to get it inside of. And this usually occurs when dealing with higher pressures of CO2, right? So think about it when hemoglobin is going to a tissue, right? Well, the tissue, it doesn't. We don't want the hemoglobin to pull this oxygen from the tissues. We want to give it oxygen, right? So this rightward shift increases as the partial pressure of CO2 increases, which means as CO2 comes in contact with hemoglobin, it's going to make it harder and harder for hemoglobin to get oxygen. It decreases the affinity, right? It makes it harder for it to hold on to and keep oxygen because we want the hemoglobin to get rid of all the CO2 in our blood as much as possible. If you increase the amount of hydrogen concentration, which is pH. The easiest way of thinking about this is CO2 is an acid, thus more CO2 in your blood is going to cause a decrease in pH. What is this temperature? Don't worry about that, that's not important. Temperature. Well, when you're working out, your body temperature increases, right? And you want to make sure all the oxygen inside your blood goes to your tissues. Well, to help this, if you increase temperature, we want to make sure the blood doesn't hold on to the oxygen. We want to make sure it gets rid of it easier. So if you decrease the affinity for oxygen, for hemoglobin, it's more likely to give away oxygen and take on CO2. This is the Bohr effect. The leftward shift is called the Halodyne effect, and it makes it easier for hemoglobin to bond. So if there is an increase in pH, right, which means there's not enough CO2, oxygen is going to bond to hemoglobin much easier. As this goes down, oxygen more readily, and oxygen is going to bind because we don't need to get rid of CO2. We want oxygen. So I'm going to decrease temperature. Here's my references. Hopefully it was helpful. Thank you very much.